Thank you very much. Thank you.
Okay, everyone, we're going to go ahead and get started. Welcome and thank you for attending our July 4th Thursday's Lunch and Learn. Remember to hold your questions. We will take them at the end of the presentation by phone and also by chat. And I will be muting the phones right now. Does anyone have any questions before we get started? Okay.
All callers are muted and they can unmute themselves.
So I would like to introduce our presenter, Liz James. She is the CEO for the Lesbian Health Initiative of Houston, and she will be speaking about the Affordable Care Act, women, and the LGBT community.
Great. Well, I want to say thank you so much to the Breast Health Collaborative of Texas. LHI, as we call the Lesbian Health Initiative of Houston, is proud to be a member of the Breast Health Collaborative of Texas. They do great work, and we think we're more powerful together. So thank Lynn and Ashley and her team for all the work they do. And welcome to everybody that's on the call. I'm delighted that we've got a good number that'll be listening in today because this is some pretty exciting news. And I will be, during this time, I'm going to give you a little view of my organization. I think that's obviously important. We do great work and we're very focused actually on what we believe the benefits will be to our community with regard to the Affordable Care Act. I'm going to be talking about the Affordable Care Act, what it is, why it's important to women and also those of us that identify as LGBT in Texas. And I'm going to talk about why it's important to you and your family and how it's going to help. And I'm going to give you a really wonderful preview of the health insurance marketplaces that we'll be rolling out in October. So let's start with LHI. We are a nonprofit, a 501c3 established in 1992, and our mission, and I'm very proud to say we are doing a good job of it. Our mission is that we are dedicated to eliminating the barriers to healthcare and promoting health and wellness for LGBT identified women, that's lesbian, gay, bisexual, transgendered, identified women and transgendered men through what are integrated programmatic areas, education, access, and advocacy. I won't go into a great amount of detail because it's up on the slides that you can see, but that is how we accomplish our work. And the reason why we exist is, like many communities that I think a lot of the folks on the phone and in the Breast Health Collaborative work to serve, there are barriers to care for those communities that we serve. And there are specific barriers to care that are also in some cases very much like barriers to care to some of the ethnic groups that exist. So I'm just going to run down this list and help people have a better understanding of why we exist and what we do with our programs. So our community is very, very uninsured. I'm going to talk a little bit in a later slide about really how uninsured we are as a community in the state. But the LGBT community has a high percentage of lack of insurance. So obviously that is a big barrier. We can't be legally married in the state of Texas. There's a few states we can, but that means we don't have access to spousal benefits. And so that's just one of the reasons why we have higher rates of uninsured. We also, as a community, and many people don't know this, in the state of Texas, we can actually be fired on the basis of our LGBT status. There's no employment protections, and so the next bullet, which says we're afraid to talk to our providers about our status, that is for a variety of reasons. Older LGBT people are more in the closet, but younger people may fear for losing that exposure may cause them to lose a job. So we don't necessarily reveal who we are. There is no real training today for the clinical care community for our population. That's another area of work that we actually do. I conduct training. And there can be multiple layers of stigma. So LGBT is not one word, and within each and every one of those letters, we're multi-ethnicities, multi-socioeconomic status, and so all of those barriers that each and every one of those facets of a person faces, from healthcare to access to other services, our community faces. And we don't, like many people, we don't understand what our health risks are, and so that's a barrier. And healthcare, there's not a clear roadmap where resources are available, so people don't necessarily know where resources are available, and quite frankly, today discrimination still exists. So what we do is LHI has programs that are, by virtue of the programs we produce, we actually eliminate all of those barriers. And twice a year we produce It's called a health fair. It's really much more than that. We do one in June and November. I'm very delighted to say that to address what is a very high population of Latinas in the community, we have an event that we have on the boards for September 7th. And this is important work that we do where we, and if we'll go to the next slide, we go out with partners, including, and you're going to notice some of the names on these. The Rose is a really important name. We've been partnering with the Rose since 1999. Legacy Community Health Services, one of the largest FQHC in Houston. We all know MD Anderson. There's the Breast Health Collaborative of Texas. But in one day, what we do is we produce an event and we serve those in our community who are uninsured or underinsured, and we provide them screening and information about resources in the community. So we are actually, if you think about those barriers I mentioned, we're addressing them in one day. And I won't spend a lot of time on this, but advocacy work is always important for all of us, representing those populations that we serve in the nonprofit space, and LHI is committed to doing that on a national, local level, and we're helping to raise awareness with the community. We're helping there to be more inclusiveness in terms of research and also policy, and we're doing a good job of that, and thanks again to the Breast Health Collaborative of Texas for being a key part of that work. Next slide. And the Affordable Care Act is it's been on our radar screen for well over a year, and we produce an education piece called the newsletter. And we have had a commitment to not only providing information about resources for our community, but we've produced Affordable Care Act articles. So why is this really important that we all be working together to understand what's happening in terms of the Affordable Care Act and make sure that the communities that we serve have a view of this? Well, the reason for that is people don't know anything about it. So there was one of our partners, CVS, in conjunction with, and it's been put out there by Enroll America, did research, and although I think with a lot of the new press, this number is probably going down, you know, the lion's share of folks that are going to have access to healthcare through what are called the marketplaces don't know anything about them, and they're going to need help actually understanding things like, okay, I've never had insurance, what does this mean, and how do I really understand what I'm looking at to get insurance? So the need is great, and that's what this slide is meant to demonstrate. So the Affordable Care Act, what is it and why does it exist? Well, the reality is there were huge problems in the United States, and they included that, quite frankly, insurance companies were making a lot of money. And sometimes they would eliminate people based on how they filled out an application. Somebody maybe made a mistake and didn't say they had a doctor's appointment, so they actually lost their policies. So it was pre-existing conditions. There were limits in terms of policy, the amount that you could actually claim for your benefits. Premiums, I think we all know, probably premiums are incredibly high. And let's face it, we have tens of millions of people in the United States that do not have insurance. So the Affordable Care Act was designed to address this and other issues. And when we look at probably one of the key issues that it was designed to address, uninsured people in the United States, we can all be proud that we are in the most uninsured by percentage of any state in the union. And so I think that's a frightening statistic, quite frankly. And this slide is meant to really give you a clear understanding of that. And I think we're probably approaching 7 million uninsured by now in the state of Texas. There's a huge impact on women. 30% of women, based on, I think this is a 2009 number, between the ages of 19 and 64 are uninsured. And contrary to popular belief, we have the highest percentage of working uninsured. And so we've got at least 20% of our employed workforce that are uninsured. Next slide. So what does it mean in our neck of the woods? So in the greater Houston area, we've got, and again, this number is probably low, but 1 in 3 are uninsured, about 1.8 million in the greater Houston area. It's tough for us to put an exact number around the LGBT population because we are not counted in surveys, but generally accepted understanding of percentages suggest that we're between 5 and 10% of the population. So I've taken a lower amount of that number. So we think that around 300,000 people in the greater Houston area would identify as LGBT. And when you take the percentage that we know is applied to the general population. That's about 90,000. What we know is that LGBT people can be uninsured at twice the rate, and quite frankly, that is also true for the Latino population. And I've also added some information here to help you understand from an ethnicity perspective what the impact is in uninsured in the greater Houston area. So as you can see there, about 11% of Caucasians, almost 44% of Hispanics, and 36% of African Americans. So let's go to the next slide. And what does this mean? This is just a startling slide. Women are incredibly uninsured, and this really helps you understand in terms of across the United States, which is the purple bar, how women are impacted. And in Texas, it's, I guess, the reddish bar, and then in Harris County, what the numbers are. And if you look at that, 62% of the Hispanic population in Harris County, it is a serious issue for all of us, but clearly there's some additional ethnic implications in terms of the impact of the lack of insurance. So when we look at the Affordable Care Act and the benefits that will be coming, obviously we've got to really focus on all our populations, but really keep in mind we have some populations that are at higher risk. Next. So the Affordable Care Act, for those that may not know, actually became law in March of 2010. Next slide. And the communities have benefited a great deal across the country by the law already. Many, there's not been a lot of this information made generally available, so I've included it. But one of the benefits that is a part of this is that insurance policies today, most of them are required to allow you to bring your children onto plans up to age 26, and if they have pre-existing conditions, they can come on. This is huge. So, we're probably at 3.5 million of young adults across the country who have been able to gain insurance through their parents' plans today. Many people on Medicare, there's been a tremendous addition of no-cost improvements in terms of prescription drugs, and also preventative care for Medicare. So a lot of folks have been actually able to access health care that are on the Medicare program across the country. And a whole lot more privately insured people have improved their coverage by the Preventive Services and the no-cost preventative screenings that have been a part of what are standard insured policies today. And this is really an important benefit. Limits, which were, if we have cancer or some real chronic care conditions, obviously limits on a policy could mean your death, quite frankly. And so that's been one of the issues that's been addressed. So I think you can see here we've got a lot of folks in the country that have insurance that are experiencing the benefits, and those young people that did not. Next slide. So a little bit more about the benefits. Today, the healthcare law requires that most plans have no copay preventative health screenings that include, obviously important to the Breast Health Collaborative of Texas, mammograms, Pap tests, colorectal screenings, and immunizations. I will provide some additional information about specifics. And one of the things my organization believes to be true is that although Medicare now, if you have Medicare, you don't have a copay for a whole lot of preventative services, including mammograms. We believe there's a lot of people that don't know that. And so right now, I'm going to tell you, everybody on this call, please know this and share this with people in your lives and people who might have Medicare. Medicare people are often on fixed incomes, and so if they had a copay before, they probably think they have it now. So instead of going and getting a mammogram or a colorectal screening, what they're doing is they're buying their food or they're paying rent. And so we're all in a position actually to probably help people get to care by knowing this fact. Next slide. I've already talked a bit about this, but children can be on health insurance plans, and in the state of Texas in 2011, we were looking at, approaching 400,000. So Texas has already experienced some benefits from the ACA. Why is the ACA important to the LGBT community specifically? A whole lot of reasons. First of all, we're families too, and so we need access to care through health insurance policies for not only our screenings for ourselves, but also for our partners and our children that may or may not have access to health care options through our own policies or because they just don't have care. Again, our rates of uninsured are much higher than the heterosexual population, and it is excruciatingly high for those that identify as transgender in our community. And if you add, obviously, the ethnic piece of being Latina or African American, you have that enhanced risk in terms of not having care. Also, most people don't know that, and we've got some limited information from the census, that the state of Texas has a very high number of LGBT people, one of the highest number of any state in the union, and we are number 3 in terms of same-sex households and also same-sex parent households, so a lot of need for coverage. Also, our community has, we're at higher risk and we have higher rates for cancers, including breast cancer, cervical cancers, skin cancers, and we also, there are some research studies that show, for example, that lesbian and bisexual women are actually at greater risk for being obese or more obese than heterosexuals. And we know from recent studies, for example, that obesity is one of the risks for breast cancer. And so it is one of those fundamentals that puts us as higher risk for cancers. The other one is, quite frankly, we're not getting to screening. Lesbian and bisexual women are 10 times less likely to have a pap test, for example, than heterosexuals, and we're at the same amount of risk. And so there's not only a need for education, but obviously the ability to have health care through policy so that we can get those screenings. And we actually have a higher risk for substance abuse, depression, anxiety, eating disorders, and this is directly tied to marginalization. And we all, I think, are very aware of HIV and AIDS in the LGBT community. It is not specific to our community, but clearly those are risks. And I personally am really very excited about the Affordable Care Act, not only for the LGBT population, but I believe it represents the largest opportunity all of us have to get our communities to care in this country. And I'm very thrilled to say that the most senior member of Health and Human Services at a federal level, Kathleen Subsidies, actually very loudly and strongly actually said to our community, and this is important from education, that this represents the biggest opportunity that the federal government and the U.S. has to close an important gap for a community that has huge health disparities in this country. Also very exciting to those that identify as transgendered in my community is that there was further clarification by Health and Human Services about not having sex-based discrimination, and there's been a clear statement that transgender people are going to be protected, and discrimination will not be allowed by law for that part of our population. Next slide. And why is it important to women? Well, a lot of those very same reasons that are there, the healthcare law and the benefits that are going to be available and that are available are important to the LGBT community. Is we've got a huge lack of insurance. I demonstrated that in an earlier slide. Also in the state of Texas, I think we're aware there we don't have enough services to meet the need across the state, and we have had an erosion of programs, and I think we've all been probably paying attention to the news. So there's a real clear lack of not only programs but fundings, and that erosion has also meant that some of those resources are gone that were there for our community. I've already spoken to the ethnic disparities, but again, that's an important piece. And at the end of the day, women are not getting access to primary, preventative, and maternity care services, and that means we have higher rates of mortality. It means that we have women who end up sick and they don't go to work and they can't provide for their children. And so there's a lot of reasons why women need the ACA, and I meant to highlight them in this slide. So how will the ACA protect you and your family? Well, I've mentioned this before, this is already happening with current coverage. Lifetime limits and yearly limits will be gone and are gone. There'll be coverage for pre-existing condition. Now children are covered, and very exciting for so many people that are uninsured is that starting in January 2014 for insurance that will be available through the marketplaces, there will be no pre-existing condition clause. Really important. Women were charged more than men, and that's not going to happen anymore. I think that's very exciting. You'll get free preventative care and screenings, very important. There will be policy cancellation protections, and for our community, and also for women, you won't be able to be discriminated on the basis of your gender. And for us, there's a clear statement that there is not to be discrimination to be allowed on the basis of sexual orientation, gender identification, and there will be guaranteed ability to appeal any issues. So really important. So what is the health insurance marketplace? This is really exciting. It is going to be a new way for us to access health care. And enrollment will start on October 1st, 2013 for coverage as soon as January 1st, 2014. And now we're going to go to a wonderful under 2-minute video that the Health and Human Services has produced that I've provided here that you're going to get online that you'll also be able to share with your populations to help understand in a real short period of time what this is.
You can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online shopping site where you shop for health insurance that fits you with low cost and even zero premium plans for those whose income qualifies. If you or your family are uninsured or just looking for better coverage, you can see your options all in one place with one application. It's a place to compare a wide range of quality health insurance plans, to review them all side by side, and choose the one that's right for you. You'll find the information clear and easy to understand. You'll explore the marketplace at your own pace. You can compare prices and benefits, see an explanation of what a premium is, and what a plan will cost you every month before you make a choice. And every plan will cover you with comprehensive benefits, from your visits to the doctor or the hospital, to your prescriptions, to screenings for cancer and other conditions. And no plan can turn you away even if you already have an illness or condition. The Health Insurance Marketplace, part of the healthcare law, opening October 1st. You can learn more right here, right now, and be ready for the new world of health insurance shopping.
Well, I personally was incredibly impressed that our federal government, which we often think of as such a huge bureaucracy, could put together such a great video. I think you'll agree it's a great, very short video that at a high level you can understand what the marketplace is. And what I'd love for all of you to do, and you'll have this information, I've provided the link, is share this out with your communities. LHI has put this on our Facebook page. You know, I think we can all use these tools very effectively to communicate with our communities. So one of my goals today is to make sure I give you some high-level information, also arm you to be dangerous, to help people understand these benefits that are coming. So let's talk a little bit more about the marketplace in terms of it rolling out in Texas. Obviously, again, it's a marketplace, and in a state where you can be fired on the basis of LGBT, we're pretty thrilled that we're going to have a health policy that's inclusive, not only in Texas, but across the country. And we've got about 38% of the 6.1 million in Texas that will actually be eligible for exchange with premium tax credits. And without, I'm very sorry to say that we are not going to have Medicaid expansion in the state of Texas, so we're going to have a lot of folks that are going to be left out of the opportunity. It'll mean that organizations like my organization, which subsidizes screening, are still going to be needed. We don't have time to go into that, but you know, it's something to keep in mind. So the marketplace, again, it was previously called an exchange, but it's going to be a place for individuals and small employers to go to, and there will be qualified health plans provided by, you know, basically pre-certified insurers that are competing for your business on this site, and you'll be able to do, as the video said, compare prices, benefits, and quality and other factors. And again, I'm going to repeat this several times throughout. Enrollment will begin in October 1st for coverage as early as January 1st, 2014. And 3 things that you really need to know. It is, believe it or not, it will be an easier way to shop for health insurance. There's a simplified way to get enrolled. All the options are going to be in one place. It is a one-time place that you as an individual or your family can actually apply for insurance, and it's, again, clear apples to apples comparison of what will be available. All of the qualified health plans that will be offered, each and every one of them will be required to have these 10 essential health benefit areas, and I won't go through them in particular, but it's pretty comprehensive in terms of being able to cover those needs that we have from a healthcare perspective. Some of the real specific coverage areas important in terms of breast health. I think this is pretty exciting news. From a breast health perspective, if you're at high risk for genetic related breast cancer, which is, I think most of us know, is a rapidly very progressive form of breast cancer that has a high mortality rate. We need to be able to get ahead of that. There's genetic test counseling, mammography every 1 to 2 years for women under 40, which is exciting given what the national recommendation is around that. Chemo prevention counseling, and breastfeeding comprehensive support and counseling. I have provided supplemental slides at the end of this presentation that list very specifically all of those benefits available. We don't have enough time to go through them, but I wanted to highlight some of them. And there will be levels of coverage. Most of us who have insurance, who have had insurance in the past, know that you can usually choose by a level, and you, again, will be able to do that in the marketplace. They use these metal standards, and it'll be depending on how high risk you think you may be from a health perspective and what your financial capability is, but there'll be options. Next slide. And I'm particularly excited about this. And if you think about the fact that we are having Medicaid expansion, I think this is a really important piece. So for young adults 30 years and under, there are going to be catastrophic plans available. Now, you have to get a hardship waiver in terms of the financing available, but it'll be a low-cost plan that'll have very high deductibles, but it'll have no cost, really important care. So it's going to give you 3 primary care visits plus no out-of-pocket cost for preventative care, and I think this is a real important part of the Affordable Care Act. Next. And I won't go into a lot of detail about this, but for a lot of people will be eligible to receive subsidies when they apply, and it'll happen at the time they actually enroll. And when you work through the form, that'll be evident to you, and you'll be able to, it's one of the keys to affordable health care in terms of providing insurance in the marketplace. I think this is pretty exciting. Obviously, these will be networks of providers, and you will have the right to choose whatever doctor that you'd like to see within those networks. I think it's very, very exciting that you won't have to go to a primary care physician to have an OB-GYN referral, and you will not have to be in network if you have a catastrophic health experience and need to be at ER. So I think these are really important parts of the Affordable Care Act. CHIP and Medicaid, I wish we had expanded Medicaid coverage in the state of Texas. CHIP, which is obviously for children, that's a part of Medicaid in the state of Texas, you will go through this mechanism. So that's exciting. Again, there's this concept of no wrong door in the marketplace. It's a goal of the federal government to simplify access to health care, and so this will be the gateway to care. Small businesses, and it's really small businesses, 100 employees, 50 employees and under will be eligible to apply for insurance for their employees. And I think that's an exciting piece of the coverage that'll be available in the Affordable Care Act. As we all know, many small employers are not in a position to offer insurance for their employees. Eligibility and enrollment. Again, the marketplace will open October 1st. And that period of enrollment will be between October 1st and March 31st, 2014. There are some requirements. You have to live in the service area. In this case, it'll be the state of Texas. You have to be a U.S. citizen. If you can be you cannot be incarcerated. So this is a question I had when I did this presentation once before. If somebody has been incarcerated or has a felony conviction, will they be eligible? And the key here is they cannot be incarcerated to have access. And I believe that's the case because there are healthcare services available to the incarcerated. So we are going to have people in the state of Texas. We have a lot of undocumented folks in the state of Texas that obviously need to have health care, but they will not be eligible for insurance through the marketplaces. I'm pretty excited about this. Today, there's already a 1-800 number available that you can begin to call and access information, but when enrollment does open, it's going to be available in multiple ways. You can get online and actually enroll yourself. There's a link that is on your screen right now, www.healthcare.gov, which will be the site that you can do that. There will be navigators and there will be non-navigators that will provide in-person, and actually there will be insurance companies helping people get enrolled. Today, what can you do to find information? Well, you can go to www.healthcare.gov. Today, there's great information available. This will be the site that you will go to enroll online. I'm very excited to say there's actually a Spanish site there, and then there is a link for telephone numbers for a great number of other languages available. I would encourage everybody on the line to go to the site, and you can sign up and put your email address or your phone number, and you can be texted and emailed information as they add information to this, and it's something I do, and it helps keep me up to date on it. So the government has done a really, really good job creating an online tool to be aware of the benefits, and then when enrollment is available where we can actually go to enroll. So this is the last slide really of my presentation before I give you my contact information. And what does this slide mean? All of us have the ability, I'm so excited to say, to change and save lives by knowing about the Affordable Care Act and knowing about the fact that health insurance exchange is coming. In my organization, we actually trademarked a phrase that we are the community and we are the change, and we know that we can do that, and everybody on the call, and quite frankly, all the members of the Breast Health Collaborative, knowing just a little bit about this and being able to point their communities to the information that are available, are going to ensure that people in our communities get the health care and we prevent disease. I'm pretty excited about that. Next slide. Here's my contact information. We'll go over that, and if you'll just actually page through the next slides, these are just slides that you'll have that talk. I've got 4 slides that go through the coverage that'll be available for women. I've got a slide about coverage for children. Look at that. I mean, you can't even read it. There's so much coverage for children that's available. Next slide is just a general slide for adults. We do, men are covered, even though I haven't really talked about men. So those are really resource slides that are available. And this really concludes my presentation. It's meant to be high level. I'm available. We've got some time, obviously, to answer some questions. And if I don't know those answers, we will certainly write that down and get back to you.
Okay, so I'm going to unmute the phone.
All callers are muted. All callers are unmuted.
Okay, so if anyone has any questions on the phone or via chat, we will accept some, or in the room. Anyone has any questions?
Or comments. I would be interested if this information was new and if you think it'll be useful, or if you'd like to share how you might share this information with your communities.
I would like to ask a question. You might have to repeat it. You mentioned that insurance companies are going to help enroll people too, but they are going to have these marketplace navigators who are supposed to be out in the community, and they're supposed to be pretty much not, they're supposed to be very helpful, but they're not really supposed to direct you in any particular help benefit. Is that?
Absolutely. So let me clarify that. So insurance brokers and agents will have this as a part of their portfolio. There will be, in fact, today, there's a lot of agencies that are going to be funded to help navigate and inform the community about healthcare. And there is actually a rule that you cannot point anybody to a specific provider in the marketplace. And I think that's really important. The government is really thinking very hard about how can we not only make insurance available to our communities across the country, but that they get a chance to make the decision without being persuaded one way or another about who should have their policy. So I'm pretty excited about that. And actually, if there are navigators, and LHI hopes to be a navigator in the state of Texas, along with a whole bunch of organizations under Gateway to Care. We're a part of Texas Health Institute's Consortium for Navigation Funding. And we will be required, should we get that award, as will all navigators, to have 30 hours of training. There will be a test and certification, and it'll be monitored for that independent.
We have another question. Someone has said that their clinic serves a largely Hispanic and uninsured population. Do you have any resources specific to Hispanic LGBT population?
That's a really, really great question, and I would say yes, LHI is a great resource to start with. We do primarily serve LGBT identified women and transgendered men, and so that it sort of leaves out gay men that would identify as Latino. We would certainly be happy to field calls and route folks to those services and those resources that we know exist. But actually, if you'll make a note, on September 7th, we will be doing a LGBT Latina and Friends, we're calling it a health event. We're actually doing it with, I'm very excited to say, we've developed a partnership with a division of the Memorial Hermann Hospital System called the Neighborhood Health Centers. It'll be in their Northwest. More information coming on that, but we will be, you can reach out to me on my contact information. We haven't quite posted that information on our website, but please reach out to me. I'll be happy to answer any questions and get you to either care that we would provide or our partners.
Ask what region she's in.
Oh,
If she's in Dallas.
Yeah, I could see. Oh, she's in Dallas.
oh,
So she's saying. So
Who?
do you have any?
Yes, please reach out to me. I've got some partners in Dallas. There's actually a really wonderful project underway in the Dallas-Fort Worth area, the Parkland Hospital. They're actually going to be doing an LGBT health assessment. I'm excited as all get out, so I'll be happy to provide some connections.
she said great presentation. She feels very empowered by learning more.
I love that.
We haven't.
You know, the reality is, and you know, I'm being pretty held back here, but I can get pretty excited about it. I am as passionate as I'll get out, because we are. I know at my organization, I'm very proud to say we do change and save lives. And I know that absolutely everybody on the phone and all of us are in an extraordinary position to be able to do that by sharing information. And I'm going to be real excited about that. How we have an opportunity to get thousands, tens of thousands of people to care in the state, and I'm excited about that.
Leah has asked, are you familiar with any potential resources for those not eligible for the marketplace, such as undocumented individuals?
You know, that is such a great question. There are not enough resources, but I got to tell you, there's a lot of folks with a focus on that. In the major metropolitan areas, I will tell you there are more resources. So in the major metropolitan areas, there are a broad number of clinics. So in the greater Houston area, they're called federally qualified health centers. Legacy Community Health Services one, El Centro is another. There's a number of safety net clinics, and you can reach out to me. We'd be happy to provide that information. I know that the resources available through the Breast Health Collaborative of Texas, they've got a list of safety net clinics. So yes, there are resources available. In the rural areas, quite frankly, it can kind of get skinny out there, but I know there's a focus on that work. I would encourage, if you are in a rural area, to get online and actually do some searching about and use the term safety net clinic and use the term, use those terms to do your search. And if all fails, if you want to reach out to me personally, I will be more than happy to connect you to some of those organizations that I'm aware of that are doing that kind of work.
Do you want to, this would be a good time to mention www.projectsafetynet.net. free online system. It's in English and Spanish.
Did you say projectsafetynet.net?
www.projectsafetynet.
I don't think.
Can you just type it in?
Is it .com or .org?
It's projectsafetynet.net.
.net. www.projectsafetynet.net. And that is a resource online for all 254 counties.
Yeah, safetynet.net.
And that
.net.
lists the federally qualified health centers and other
Spell that
resources.
right?
Thank you, Lynn, for providing that.
And if people have problems with that, it's also connected
It's on our website.
to our breast health, texas.org, which is specifically just breast health information. So,
You know, and I think the other question is, how are we going to serve those that are falling in the gap? Organizations like LHI and all the other great organizations that are doing great work today need to continue that work. We go out and raise money to pay for mammograms and PAPs and all kinds of things, and we're going to continue to need to do that.
I do want to say too that one of our earlier webinars, and it's listed on our website, had a speaker that talked more about the LGBT community, and she was out of San Francisco. And so if you want to access that off of our website, we do archive all of our webinars. And I think if you want to learn more about the LGBT, I was really blown away because I didn't realize how much really the elderly LGBT community are truly, what's the word I'm looking for? Discriminated against, especially in retirement homes. And so I learned a lot from that webinar. So.
And the older LGBT, and that webinar was focused more on what I would call LGBT cultural competency care. So it's a great webinar that's archived on the Breast Health Collaborative site. And older LGBT people, you know, are more in the closet. They're from a time, and I'm one of them. I know people who have had shock treatments and have had horrible things happen. And I'm not saying discrimination doesn't exist today. It is, you know, I think young people I'm excited to say many young people feel much more comfortable being who they are. We got a long way to go, but older people certainly face challenges. And older people don't necessarily have the support networks around them. And that's another issue.
Another question, do you know of any online or hard copy resources geared toward educating healthcare providers on best practices for treating and interacting with LGBT patients?
There are some good ones. Actually, the Fenway Institute, Fenway, and if you do a Google on Fenway Institute, they've got some great online training. If you're in Houston, I've developed, it's about an hour training, it's LGBT Cultural Competency 101, that provides a great overview of why it's important and how you engage and from how you make your office welcoming to how a clinician actually would engage a client to what's the difference between sexual orientation and gender identification. And I also, in that, provide a huge resource directory of information, not only the Fenway Institute, but also protocols of care.
And if there is an interest from our listening audience or those that are here, I've kind of talked to Liz about this earlier. We could always offer a webinar separate from our 4 Thursdays and be able to have that to our membership or those that are interested that may not be located in the Houston area, that we could do it by webinar.
Yeah, and it's really important. I didn't include this. There was a lot I could have included in this presentation, but there's it's really important for institutional medicine. If you're a hospital and you're subject to the Joint Commission standards, which are basically all medical institutions that do provide Medicare services and Medicaid services, you have to abide by the Joint Commission standards. And actually, there's a patient standard requirement that says that you cannot discriminate with your patients on the basis of sexual orientation, gender identification. And for most institutional providers, that's important because it costs a lot of money to be reviewed by the Joint Commissions. In addition to that, the Institute of Medicine has very clear statements about the need and has recommendations around not only the fact that LGBT people have issues getting to care, but they have special, unique healthcare issues, and clinicians need to be trained to deal with them appropriately. So there's information available.
I think also, and tell me if I'm wrong on this, Komen, a lot of the Komens have resources online, and I think just like they have, like booklets or, little flyers about African American women, I believe they have one also on the LGBT community on how to work with patients, especially breast cancer, people that are going through mammography screenings for the LGBT.
Yeah, Komen does have some good information. We provide a bit more, and I want to stop and thank Komen. Komen is a funder of LHIs. We're very, very grateful for Susan G. Komen, the Houston chapter, for supporting our programs this year. It's a new relationship, so thank you for mentioning them. The American Cancer Society has tremendous flyers that they have produced. And, when you think about flyers, people want to see themselves in flyers. And so not only do they speak the LGBT population, but we've got pictures of us on them. And it's a great way for a clinic to make an environment feel safe when somebody comes in, because we all go into an environment, we sort of check it out to see if it feels safe for us, whether you're LGBT or not. And I think for a clinical provider, let's face it, the American Cancer Society has a lot of credibility, and to go and get some of those flyers and put them in your office is pretty simple.
Okay, well, thank you so much, Liz. It was an excellent presentation. We also want to thank this year's program committee for organizing our webinars. It is chaired by Laura Pena with Harris Health Systems, and the members include Gina Lawson with BCCS and Lizette Martinez and Yesenia Mora, also with Harris Health Systems. Our next free webinar is Thursday, August 22nd at noon, and it is on cancer survivorship management for healthcare professionals. It will be presented by Dr. Louis E. Foxhall with MD Anderson Cancer Center, and you can register on our website, bhctx.org. Thank you everyone for your time, your attendance, and your participation.